I want to take a moment to hear a bit about what Facebook is doing in the health sector. For those who don't know, KX met Mark Zuckerberg, I think on your first day of classes at Harvard, if I have that right, and you actually graduated, unlike Mr. Zuckerberg, which hopefully you needle him with once in a while. You were one of the early employees, and you were involved in some of the core elements of Facebook that we all know, newsfeed, advertising, groups, and you recently, as I understand it, chose to take on this role of leading health. So a pretty big thing for our community. I'd love to know, what does that mean? What is Facebook doing in health? What's your vision for it?
Great, thank you, and thank you for having me. Really excited to be here. So it really starts with the Facebook mission, which is to give people the power to build community and bring the world closer together. And I probably don't need to tell other people in this room this, but people have really always relied on others and their community for support around health, whether that's caregivers, family, health workers, and so on. And with the rise of the internet and phones, more and more of this is happening online. And so I think for me personally, I just felt there was a real opportunity and actually just a responsibility to better support some of those needs. And that's what my current team, which is part of our broader social impact efforts, is focused on. So finding ways to help bring people and organizations together to improve health and well-being.
And maybe you can give us an example. I know it's early, but a sense of where this can actually have an impact in health.
Yeah, I'm gonna give you a couple. So probably our most mature product is our blood donations tool. And this really came out of a need that we were seeing happen on our platform. So people were actually asking their friends and family for blood donations, and this is happening quite a bit, especially in markets where the blood supply is more on the replacement model, where the burden is actually on the individual to find donors. And at the same time, we were also seeing blood organizations using our tools like groups to organize donation drives and camps. And we thought we could work together with these people and organizations to better support those needs, and we ended up building a tool around blood donations, and it's actually pretty simple. So on one side, people can opt in to be registered as blood donors on Facebook, which just means that you only get notified when there's a need locally. And then we also work really closely with blood organizations so that when there is a need nearby, we can notify the donors. And this product's been around for about 2.5 years now. Excited to say that at this point, over 60 million people worldwide have signed up to be donors, including over 40 million people in India alone, which is one of the first markets we launched the product to. And probably more excitingly, it's not just the numbers of people who have signed up to be donors, but we're seeing increasing evidence that this product is actually driving incremental and significant new donors to blood banks and really helping, and that's coming from the partners themselves.
Do you have a sense yet of the 60 million, how many have been able to actually donate at this point?
I think not specific numbers, but certainly from a blood bank perspective, we have many case studies where individual blood banks are able to like survey people and attribute people on the way in, and a very substantial percentage of those are coming from Facebook in some of these cases.
Gives you a sense of the scale of the platform.
Yeah, so that's one example, and then a more recent example is a lot of our work around coronavirus, COVID-19. And here I think there's a clear need for people, ultimately people want information and accurate information about what's going on. And so we're working really closely with organizations like the WHO, as well as a variety of local ministries of health to help them meet people where they are and searching. And so when people search for, say, coronavirus or related terms, we will show credible information at the top of those results and link to the WHO website, or to relevant other websites, as an example.